Well, we've got a packed room and a packed agenda, so I'm going to get right to it. If my kids were here listening to what I'm about to say, they'd be interrupting and teasing me, saying, I know, Mom, back in the day. Because I'm going to start our awards program with a quick trip down parity memory lane. We started the parity journey here when we passed the first comprehensive state parity law in 1993. Randy Lutz, do I see Randy Lutz here? I know Randy is supposed to be here, but I do not see him, and I'm mentioning his name because he played a big role in bringing our organization and NAMI Maryland together on this bill. At the time, the debate was centered on whether coverage should be limited to treatment for biologically based illnesses versus coverage for what was then referred to as the worried well. Kind of hard to believe today, and thankfully that term has been erased from the conversation entirely. So we celebrated our success in '93, but years later it seemed that little had changed for people. 15 went by before the federal parity law passed in '08. We celebrated again and launched a project helping people file their parity complaints while we waited for clear regulatory guidance from the feds and were frustrated by the slow pace of action to settle consumer complaints, some of which sat for a year or longer. Henry Harbin, who also is not here yet, was everywhere on this issue, working at the national level and urging all of us in the states to do more. And so we've continued to rally here in Maryland, tweaking state laws seemingly endlessly to better safeguard the public. 30 years have now gone by since we passed that bill. And so it was a breath of fresh air when Kathleen Birrane, the recipient of this year's Distinguished Service Award, arrived on the scene as our new insurance commissioner in 2020. Commissioner Birrane quickly demonstrated a strong commitment to ensuring that parity would be honored. Her consumer-focused approach was evident through the process she employed when she assumed responsibility for ongoing network adequacy hearings that were happening here. We saw her leadership in action when MIA implemented the requirements of 2020 reforms put forward by the Parity at 10 Coalition. Commissioner Birrane and her team established a parity reporting framework that is among the strongest in the country. In fact, Maryland's framework has been cited by the federal government as a model for other states. It's those non-quantifiable limits on care, the things that there's just no way to easily count, that pose the biggest access challenge. Thanks to Commissioner Birrane and her team, thorough data requirements are now the standard in Maryland, and this standard will protect Marylanders in critical areas: review of service denials, utilization practices, credentialing practices, and reimbursement rates. Commissioner Birrane understands that it's essential that Marylanders understand the law so that they are able to enforce their rights. She and her staff have held educational seminars and are implementing a broad range of strategies to address this need. She has issued strong parity compliance orders, and in December, released an interim report offering 8 recommendations that will enable MIA to strengthen enforcement of the law. These provisions are the foundation of several parity bills that are under consideration this year. Commissioner Birrane, we are most grateful for your leadership, for the compassionate way you have carried out your charge, and for the fair and balanced actions you have taken to uphold the law and protect the public's right to care. We are honored to recognize you with our 2024 Distinguished Service Award.
So sorry as my still healing meniscus and I hobble up here. So thank you very much, and I'll try to be brief. I'm deeply honored and really deeply appreciative of this recognition, which is really not a recognition of me, but a recognition of the people at that table that actually lived this out and saw this into being. But on a personal level, I can tell you that of all the various things that I work on as the State Insurance Commissioner, this issue, working to assure parity and access to quality mental health and substance use care, is the one that is most personally important to me, the one that is closest to my heart. Out of my own experiences with people that I have loved, it is so important that we end this false narrative that mental health care is somehow less important or less necessary or less worthy. I was saying, suck it up, buttercup attitude, right? Healthcare is healthcare, and we are fully integrated beings whose mental and physical health are interrelated. You know, a lot of you who know me know, I talk about my oldest niece, Julia, who's a licensed clinical psychotherapist in Philly, and she and I talk a lot about access to challenges for her, for providers, getting a network credentialed, all of those things and what that means. Of course, most of my friends, back in the day I worked at Sheppard, I went to law school, they stayed in the trenches, right? So most of my friends are mental health professionals, people like John Hackbarth that you may know from Catholic Charities for years. Well, my other niece, Anna, is also in this field, and what she focuses on, her advanced degrees are in neuropsychology, and she runs a clinical trial lab at the University of Pennsylvania, and her particular research area is looking at trauma and how trauma actually results in physiological, neurological changes and what that means about treatment. So what the art and science of medicine tells us, what practitioners know and understand, is that, again, healthcare is healthcare, and we have to end this false and divisive narrative, and we have to make access to all forms of healthcare, including mental health and substance use care, available for everybody. So that is what's near and dear to my heart. My team know that, but it's also near and dear to their hearts as well, because while I do thank you personally for this, this honor really doesn't belong to me at all. Because the activities that you have highlighted are hardly mine alone, and frankly, they're not even mine in great part. What you recognize today are the members of the MIA team, some of whom were able to be with us today, and I'm going to ask them to stand. You three guys would just stand. And I want to ask you to celebrate and applaud them. So you have Erica Bailey, who is currently our Chief Hearings Officer, but who helped in the trenches getting legislation, sensible legislation passed. You have David Cooney, who's our Associate Commissioner for Life and Health, and Mary Quay, who is our Associate Commissioner for Market Regulation. They did the lion's share of the work in getting difficult, knotty, parity regulations and data requirements done, as well as updates, comprehensive updates to our network adequacy. And who couldn't be here today is Joy Hatchett, who many of you know is the Associate Commissioner for Consumer Education and Advocacy, and Lisa Hall, who was our Deputy Principal Counsel for many years and retired 2 years ago. Because I got to tell you, Lisa was the visionary, and she kept driving us just a little bit further and a little bit further. Don't leave this behind, don't leave this out. And we'd be like, oh my God, can we do that? She's like, do it. So a lot of what you see that is groundbreaking in Maryland is because of this team, and particularly Lisa. So I like to say I just keep the wheels on the bus and maybe some gas in the tank, but they are the drivers and the deliverers of progress. So I'm accepting this for the MIA team. For me personally, I'm just going to treat it as a challenge, because every step we take, there are 10 more steps that we need to take, and we need to keep moving on this. You're going to see the network adequacy regulations that went into effect this year. There was a very short time frame, so we've been working with carriers from the time that they went in and then their annual reporting. We are cautiously optimistic based on the conversations that David and his team are having, that we're going to see real changes in networks because of those new regulations. There's a lot of work still to be done on the parity work. Read our report, it'll give you an update. The last thing that I just want to mention, just very briefly, I'm going to invite you to reach out to Commissioner Hatchett, and I don't know if Laura Torres was able to make it there. She is in the back of the room. You want to stand up, Laura? So I will identify Laura because Laura is one of the leaders of the Maryland Insurance Administration's brand new health coverage assistance team, which we call HCAT. And its goal is to help people who have coverage difficulties before they become enforcement issues. Because we don't want to see coverage questions become barriers to health care, particularly behavioral health care, and that's what is going to be one of our first areas of focus. So we're soft launching in about a month and a half. We've done a lot of work with a lot of agencies, some of whom are here, and thank you for your assistance. And we've done a lot of work with large groups, and we're going to be seeking more assistance from you. But our goal is every time somebody feels like they have a denial or they don't know how to ask for coverage, we're the place the provider can send them. We are the place where they can come, and whether it's health insurance or Medicaid or Medicare or self-funded plans, we are going to walk with that consumer every step of the way and help them work through the coverage issues, get them to the right place, and if it's health insurance, we can do the enforcement work as well. We're partnering with HEAU, but this is the goal, and most importantly, we're going to collect data about what those coverage denials are about. So a lot more to come on that, but again, to me, this is a challenge to see what can we do next, and thank you very much. Maybe I'll take pictures.
You're part of the team. Let's do a group shot.
It's your award.
We have 2 Distinguished Service Awards this year, and we are presenting this second one with a mix of emotions. Today, we recognize Jeff Richardson for his 37 years of service to Marylanders as he prepares to move on to an exciting new role in Austin, Texas. Having both come to our respective roles at nearly the same time, it has been an honor and a privilege for me over those years to watch Jeff build a compassionate and comprehensive system of care at Mosaic across nearly 4 decades, to have the opportunity to work side by side with him on shared goals for the public, and to have him serve as board president and a valued leader in our organization. I will never forget how inspired I was when I participated in a CQT site visit with consumers at Jeff's program. People were so appreciative of the care they received and how they were treated. I remember being almost brought to tears when one woman shared such gratitude at how this program had saved her life. That really says it all about Jeff. And I know he doesn't particularly like being the center of attention in this way. So I decided to share the love and enlist 2 of his colleagues and friends to help me out in further torturing him. With, as he said when we had lunch last week, these bromides. I think that's the word you used, and what you were hoping to avoid was these bromides that I have been sharing about you. And so I will say sorry about that, and then call on Chuck Angolia, President of the National Council for Mental Well-Being, and Shannon Hall, Executive Director of the Community Behavioral Health Association, to join me in recognizing Jeff's accomplishments.
Oh, this is fun. Well, thank you for inviting me up here, Linda. And Jeff, I don't thank you for giving me the opportunity to deliver these remarks. Good afternoon. I'm Shannon Hall. I'm the Executive Director of the Community Behavioral Health Association of Maryland. This is our 40th year of representing mental health and sub-organizations in Maryland's public behavioral health system. For more than half of that time, we've had the privilege of having Jeff Richardson serve on our board in various capacities and contribute to the running of our association and the launch in 2019 of a provider network. So just a little trip down memory lane. 24 years ago, Jeff began his first stint as CBH's board president. This may be unfamiliar to some of you in the room, but in that time, in 2000, the state had just closed 310 state hospital beds, but invested less than a third of the money identified in the concurrent expansion of community-based services. So less than a third of the $56 million identified as needed was put into expanding community services. CBH was only 3 years into its multi-decade effort to secure rate increases to help providers address annual inflationary pressures on their services. And PRP enrollment was at 13,700 individuals, spawning efforts at the state to address the management and utilization of PRP services. Jeff began his stint as CBH board president asking us to focus as a community on several things: innovation and the importance of measuring outcomes and the results of our work. So some things change and some things don't. But throughout his subsequent service, Jeff has always pushed CBH and our members to focus on these things. And under his leadership, CBH created a culture of cooperation among its providers that I think has really stood out. He's always seen the value of providers working together. I took this job because Jeff called me and encouraged me to apply for it, and in talking to him, what made it attractive to me was the idea of a provider network, of what providers could accomplish working together. And when we launched our provider network in 2019, half of our association members joined immediately. And the breadth of our network's work in outcome measurement and in innovative technology rests on a vision that Jeff began articulating for us 20 years ago and has pushed us and nudged us and supported us in working to achieve over the intervening decades. I think I can safely say no other provider network in the country can connect its participating providers into a data warehouse live connected to the state's health information exchange. No other association is supporting the coordinated implementation of measurement-based care through benchmarking at the scale that CBH is. We lead the country in these efforts only because we are standing on the shoulders and building on the vision that Jeff has been articulating for us. And his commitment of culture is not one that exists in theory and academic practice only, but also in practical reality, not in the untold hours that he has devoted to our associations and to supporting us as leaders, but also, I think, in the day-to-day reality. It was, I think, several years ago, we were all at a National Council event when we got a phone call that one of our members had had a fire, a deadly fire at their facility. And I was with Jeff and that CEO when Jeff put all of the resources of Sheppard Pratt behind supporting that organization, saying, can we come down? Can we cover your reception desk? Can we connect you to the communications department? And really helping to be there for another one of our members in a way that I think meant a lot to him and I think meant a lot to us as a community. It's unusual, I think, to have one of your strongest members believe so strongly in your collective purpose and what you can accomplish together. It's a resource that Jeff might dispute this. I've never taken it for granted, though. We've always appreciated it. And Jeff has also brought us Chris Richardson, who has helped CBH in our office management on multiple times. So losing both of them to Texas is really unfortunate from my perspective. We convey our deep, deep gratitude to you, Jeff, and to you, Chris, for all that you guys have given us over the years and all that you have believed in. You have made Maryland a better place because of your work. So thank you very much.
So I know you'll find it hard to believe, but somehow Jeff has been able to not only balance his responsibilities as a CEO, as a board chair for this Mental Health Association of Maryland and CBH, by being on the National Council's board for 16 years. We really do have term limits, but he really kind of pushed the envelope. He got drawn into being on the leadership track of this association, which represents 3,400 organizations around the country. And I know you might find this hard to believe, but you know, Maryland is not like Texas or Oklahoma or Florida. And somehow through all of that, Jeff was able to bring a level of compassion and a way of bringing people together so that we focused on what we had in common, not in how we differed from one another. And any time that we would have like an innovation, I'd go to Jeff and I'd say, hey, we're thinking about this, like, have you thought about there's testing genes to figure out which medication might be good for someone? And he'd be like, oh, we've done that for 10 years already. Or I go to him and I say, we've got this wonderful idea about this new thing, this company from England wants to bring something to the United States. He said, we'll try that. You know, he's always open to new ideas, always trying to push the boundaries for better care. I've seen him, you know, with an event with Senator Mikulski. I've heard him talk about being with donors. But the event that I'll never forget is being with him at one of the locations in Maryland. And all of the consumers who work there, whose job was to welcome people, all came up and talked to Jeff by name. Jeff knew all of their names, and he was engaged with them, and there was, you could tell, so much mutual respect. And this is somebody who not only can think the big thoughts, can think about the future, but also cares about people. So Jeff, what an honor to be able to here to celebrate you. Thank you.
How much time do you guys have this evening? So, quick question first. How many people is this their first time they've ever been at this reception? Wow, about half this room. Well, they don't know yet, do they? No, I'm going to keep my thoughts brief because this is like a butterfly effect into the entire evening. If I'm not short here, then it continues onward and I'm in the way between you and the food. So, and you guys are going, yeah. The ones that have been here before saying, yeah, come on, Jeff, let's move. Just briefly, I just want to sort of echo the comments that all three of these guys, who actually, I think I was all three of your bosses at one point, so, and you still like me, so that's nice. That it's been an enormous privilege to do this work. I also would dispute your comment about being the center of attention. If you just talk to my wife or my colleagues at Sheppard, they'll tell you otherwise. So, but I want to thank all of you. I've had a privilege of working with most of the people in this room. We fought these battles for decades. We've been through years and years of transformation efforts, hope for something better. And I can tell you when I first started doing this work, we were talking about folks deinstitutionalizing from lifelong stays in state hospitals. And right now we're still struggling with those same issues in a different format. We have made enormous progress in this state because of all of you and all the continuous effort to make things better. So thanks for the award. I guess if you go to Texas, you get an award or you die or something. But I want to thank all of you for everything that you're doing and will continue to do for this community. I want to particularly thank my wife, my colleagues, and all the good people I've gotten to work with in this room, all the consumers and all the families that you all will continue to support. Keep up the good fight, guys. Thank you so much.
So we are going to try really hard to stay on track time-wise today, which is not something we're typically very good at. 15 minutes before this event started, we got a call from one of the secretaries who's on the agenda after 5 because of an event at the governor's house this evening that starts at 5. So Dan and I were running around frazzled, needing some mental health support, trying to figure out if we could move the entire agenda, and by 5:27 we decided we just couldn't. And so we're going to try really hard to stay on track. I'm going to hand off to Ann Geddes, who leads our child and family policy initiatives, and we're so excited to have Ann join the team. She's been a lifelong family advocate and a great leader in the space. So Ann is going to come up and present the next award, followed closely by Dan Martin, who leads our public policy area and I think needs no introduction, to do the last award. Thanks, guys.
Hi, everybody. So it's my honor to present tonight the PAULA HAMBURGER Child Advocacy Award. And no one, I believe, that I'm aware of is more deserving of this award than Willis-Gorman, new last name, get the name right, new last name. Rowan has dedicated her life to supporting youth and young adults, peer support, self-advocacy, leadership, and policy advocacy. Her efforts have had a profound effect on the lives of many young Marylanders who have lived experience with behavioral health services. Rowan was among the first young adults in Maryland to provide young adult peer support, working on Maryland's Eastern Shore. There she also led youth retreats and support groups for LGBTQ plus youth. I know the youth retreats could be a challenge, but she pulled those off. Rowan moved on to support youth and young adults throughout Maryland at On Her Own's Transitional Age Youth Outreach Program. And that was when Rowan was with On Her Own, was when I had the opportunity to work with her, particularly on the What Helps, What Harms project, which is a youth, young adult feedback project asking youth around the state in focus groups from the Eastern Shore to Western Maryland, just those questions. What helped, what harmed, what services and systems were helpful to you and which were harmful to you? And putting together after that a policy paper for policymakers and providers to inform their work. Also at On Her Own, she led more youth retreats, mentored peers in pursuing the field of peer support, and engaged other young adults in advocacy opportunities. Rowan did not confine her activities in Maryland. She served on the board of directors of Youth Move National and was later president of the board of Youth Move. Rowan was a passionate advocate for the inclusion of youth and young adults with lived experience as equal partners in systems change. And her training of young adults in advocacy has brought about a cadre of leaders in Maryland that are helping to improve the system of care for youth. Through her impactful sharing of her personal experience, Rowan has had a truly transformational effect on those around her. Her unwavering dedication has left an enduring legacy in Maryland, and I'm very happy to present the PAULA HAMBURGER Award to Rowan.
Hi, everyone. Thank you so much, Anne. It means a lot to have this coming from you. And thank you to Linda and to the entire Maryland Mental Health Association team. I am so honored and humbled to receive this award and to be able to share this recognition with some amazing advocates like Michelle Zabel, Claudia Remington, and Tom Merrick. I have to thank Lauren Grimes, who founded the Tay Project on our own of Maryland, and made all the work that came after possible, and was and is my mentor and friend. And I want to thank my mother, Jan Willis, who instilled in me I think, pretty annoying drive to push for what I believe at a very young age, and heard my voice and advocated for my autonomy and taught me that I could do that. And to my amazing wife, who listens to all of my impassioned rants very patiently and supports me as I still strive to understand the meaning of a work-life balance. I have been so blessed to be able to work in this field for the past 10 years, and alongside so many phenomenal youth advocates and supportive adults, in which I see many faces in this crowd who I know fill those roles. Whether it be the librarian that I worked with at the Baltimore RICA, who very aggressively and passionately gained special permission for his young adult students to attend On Earn of Maryland's Advocacy Academy, and then stayed after hours once a week for 5 weeks at night for them to attend so they weren't alone. Or the young adults that I had the privilege of supporting who, within the hour they met, all discovered they had the same negative experience of hospitalization, and then consequently discovered a solution that would have fixed that problem for all of them without my guidance or support, just on their own altogether. Or the staff of the Maryland School of Pharmacy, who, upon being connected to the Tay Project and realizing the importance that youth voice has in any work, has since then strived to make sure that a youth advocate is a part of all of their youth-facing projects as an advisor. If the pharmacy department can do it, everyone else can. The beauty of youth voice is that we all have the ability to nourish it, support it, and provide it the opportunity to grow. Everyone here has the capacity to be that connector and open that door for a young person. Whether it be Holly Ireland and Heidi Rochon, who I know are both here, who gave me my first opportunity to work in this field at Midshore Behavioral Health Systems, or Tom Merrick, who created the funding opportunity for the Tay Project to start, or MHAMD, who I've heard has a very lovely youth short film for us to watch later, and I'm very excited to see, which was so lovingly created by Chris Locus. Thank you again to MHAMD for this award, and I encourage everyone here to find at least one way to bring a young person into this world and give them a supportive place to share their experiences and change our systems, because we all know they can. And I will promise to be short, and I hope you all have a great evening.
Bring this up and make it easier. Transition. So, hi everybody. I'm Dan Martin. I'm the Director of Public Policy at the Mental Health Association of Maryland, and I am honored to be presenting our Legislator of the Year award this year to Delegate Heather Bagnall from Anne Arundel County. So this has been a few years in the making. I was really hoping, I've been known for years that I was going to give this award at some point, but I was really hoping it was after the Modernization Act, big Modernization Act thing that we had in 2022, but we had to wait another year. So 2023 was really a banner legislative year for behavioral health in Maryland. The Maryland Behavioral Health Coalition, which many folks here are with organizations that are part of, upwards of 100 organizations now comprise that coalition. came into last year's legislative session with a really ambitious package of bills designed to expand Maryland's behavioral health workforce and prevent behavioral health crises by improving access to quality community-based behavioral health care through an expansion of innovative and proven care delivery models. And in the end, the best legislative session that I've experienced in my 13 years with the Mental Health Association, every single thing that we brought to the table passed in 2023, due in large part to our biggest champion in Annapolis, Delegate Bagnall. Delegate Bagnall was the lead sponsor of legislation last year expanding Medicaid reimbursement for the collaborative care model, which is a proven integration model that expands the quality of behavioral health service delivered in primary care settings, which is where most individuals with mild to moderate mental health and substance use disorders first go to access care. This is something that the Mental Health Association and our partners have been working for years and years to accomplish, and we finally got it across the finish line last year. Delegate Bagnall also spearheaded a bill establishing a behavioral health workforce investment fund, which is going to go a long way to helping us address Maryland's persistent behavioral health workforce crisis. As part of that bill, the Maryland Healthcare Commission is working now to do a really, really comprehensive behavioral health workforce needs assessment, kind of modeled after one that happened in San Diego a few years ago, that is really paying off in terms of, again, building a behavioral health workforce in that jurisdiction, and I'm confident that the same thing is going to happen with this piece of legislation. And speaking of children and youth, Delegate Bagnall also was the lead sponsor of legislation last year designed to restore access to high-fidelity home and community-based wraparound care for children and youth. And so, these bills are critical components in our efforts to ensure access to care for every Marylander in need, and we could not have done it without the hard work and dedication and passion of Delegate Heather Bagnall, Mental Health Association of Maryland's Legislator of the Year. So,
Well, you've left this playwright speechless. It always means a lot, these awards, but this one means so much. I'm sure you heard a theme tonight. It takes time. And I'm going to speak tonight from the heart, which is what my chair always says. First of all, thank you to the Mental Health Association of Maryland, not just for this award, but for all of your advocacy. I came in with the class of 2019, and we came in with a mission. A lot of us were coming in wanting to improve our behavioral health system in Maryland and really make some momentum and not accept the status quo. And I was surprised that people were so grateful that I was willing to take on these bills. And they said, well, they're really hard, and they're a lot of work, and they're often not the priorities. But if you were to ask the room to close their eyes and raise their hands if they had been impacted themselves, their family, their friends, colleague, by a mental illness, every hand would be raised. Now, if you left your eyes open, not so much, because we're still dealing with the stigma of mental health. My job outside the legislature is in the arts. So my job is to make the impossible possible. So when they said, it's impossible to make improvements in behavioral health, I went, okay, challenge accepted. I work in the arts with, for the last 30 years, I've worked with people who transformed their personal trauma into something beautiful and meaningful for other people. And when I ran for office, I talked about the fact that I was an artist. And people would say, don't talk about being an artist. Nobody will take you seriously. I was like, well, that's offensive. So, what does that say to all the people that I've worked with, all the people that I've learned from, all the people that I've mentored? So I ran as an artist. I actually was told 3 things. I said, don't run as an artist, don't talk about public transportation, don't talk about affordable housing. So I ran as an artist on public transportation and affordable housing. But in the middle of my campaign, my brother suffered a severe mental health crisis. It was public, it was scary, and the first thing that I heard from people was, so does that mean you're dropping out of the race? And I had the same thought as when people said, well, don't tell anyone that you're an artist. I said, what does that say to everyone else who has had a family member with a mental health crisis? I said, no. Again, I know what my job is now. My job is to run, and my job is to make a difference. And what I saw, because I refused to sort of disappear and shy away, is that people started self-identifying and saying, thank you so much. This happened to my family. This happened to my family. And all of a sudden, all those hands started going up and eyes were still open. So it is my absolute honor to do this work every day. And I just want to thank everyone in this room for your advocacy, because it's what makes this possible. It's what has helped us build this momentum. I also want to take a moment of personal privilege and give a shout out to the Anne Arundel County Crisis Intervention Team. Who taught me there's no such thing as a wrong entry point to the behavioral health system. So thank you so much. Thank you to the Mental Health Association of Maryland. Thank you to my staff. Thank you to all the advocates. And thank you for standing up and being champions of mental health in Maryland. Thank you, everyone.